So good day, everyone. We will start with the event now. And today's event is focused on wastewater-based monitoring and surveillance for public health and sound environmental management. My name is Heidi Savelli. I'm acting chief for the Source to Sea unit in Nairobi, Kenya, with the United Nations Environment Program. I really welcome every person that's online and in person as well. Oh, this one. And so we'll focus a little bit more today on a topic that's been increasingly on the radar of the public and decision makers, especially since the beginning of COVID. It's wastewater surveillance. We will take the opportunity during the event to hear from eminent experts on activities that have been done in this context, on some of the latest trends and how it's possible to analyze these types, some case studies, and also discussions about the future of surveillance, both for public health as well as the sound management of our environment. So what is surveillance? Well, it's not a new topic. It has been around before, but with the COVID-19 pandemic, it became an opportunity to measure what's happening in the pandemic through wastewater surveillance. We know that wastewater has the potential to act as a sentinel in detecting future pandemics as well. And it's not limited only to COVID, of course. There are other opportunities that can be used for, including antimicrobial resistance and other issues to address and protect freshwater and marine ecosystems, as well as public health. We will take the opportunity to also check what's your knowledge on wastewater surveillance through a short Mentimeter, which will start within the next couple of seconds. I wanted to highlight that UNEP has been involved and contributed to the efforts on wastewater surveillance, both by sustaining dialogues around it, try to increase the familiarity on the topic, convene experts to further explore what the opportunities are around wastewater surveillance, and also to raise awareness about the link between sanitation, wastewater, and COVID-19. So I think we'll move to the Mentimeter, and we really look forward to these discussions today. And we will shortly introduce the speakers that will lead our knowledge on the topic. I'm handing to our colleagues in Nairobi to move us into the Mentimeter. Again, this is to guide a little bit on how to do it. So there will be a few short questions. It's more yes, no, I do know something. So how much do you know here of the audience? I'm sure the experts know quite a lot, so you do not need to answer unless you wish. But that's the first question. And you can see you join at the Menti use code, so at menti.com, and you have the use code at the top of the screen, which is 29460968. So we'll run through the questions. And then Alex, my colleague, will reflect a little bit on the results. So first one is, what does your country organization work on? Does your country organization work on wastewater management? We see here that yes, many. So far answers are yes, we are working on it. I think we can also move towards the next. It's not a surprise maybe that many in the audience are working on wastewater management. So colleagues in Nairobi, then we go to how familiar are you with the concept of wastewater-based surveillance, and it's important in public health and environmental management. We can see that some respondents are quite familiar with, they are working on it and are an important stakeholder in this. A few feel like maybe they don't know so much about it, so then this is an excellent opportunity to become more familiar with it. I think we'll move towards the next question. Are you aware of any successful cases where wastewater surveillance has helped in early detection of disease outbreak? It's a quick yes, no, maybe. Again, just to gauge. Great, so we hear that there are a few good examples, or maybe others. Yeah, so a mix. So again, this is excellent for our experts and panelists that can then help in shedding some light on this. If we go to the next, so maybe some cases we saw are available, but more can always be used. What role do you see the individuals and communities playing in supporting and contributing to wastewater surveillance initiatives? So yes, definitely I see an inclusive crowd, and also that many stakeholders are part of the dialogue and decision making, but improvements can be made, and that they're absolutely crucial. Excellent. I thank you so much. Colleagues in Nairobi, this is the end of the Mentimeter. So then thank you again for engaging. I think this is super helpful for for our experts to also know a little bit about the knowledge in the audience. Then I'll start by introducing Kartik Chandran is Professor of Earth and Environmental Engineering, Columbia University. He'll start with setting the scene. And then we'll have two other experts, Bilge Aslapan Kosameni, Professor from the Turkish Water Institute, SUEN, and Zeynep Setesoglu, Associate Professor, KTH Royal Institute of Technology. So very much welcome, and thanks for agreeing to be part of this event. And I think we'll give you, Kartik, the first floor to set the scene. Thank you and welcome.
Thank you very much. Thank you for having me here. Thank you for having us here. So, sorry, I got someone else's feed. Okay, let's start. So I'll just, let's say, try to set the scene, and let's, to start with, the concept, as Heidi mentioned, surveillance of environmental reservoirs is really not something that began around the time of this current pandemic. In fact, around 170 years ago, similar principles were used by Dr. John Snow to perhaps pinpoint, let's say, if not a conclusive source, a fairly develop some evidence around how to reduce the impact of cholera in London. And yeah, so ultimately, through some detective work, if we can use that word instead of surveillance, the contribution of fecal contamination in a drinking water source, a public drinking water source, a hand pump, there was evidence that suggested that could be the source, and then as soon as that source was cut off, the incidence of cholera was reduced. I'm just again giving you a very qualitative and somewhat of a simplified narrative here. So this, I think, was one of the earlier incidents of the use of surveillance, environmental surveillance, to protect and enhance public health. And since then, and even before then, there have been many different studies, incidents over time in many parts of the world. This is some data from the Bill and Melinda Gates Foundation, focused on typhoid, where through a combination of environmental and clinical surveillance, there are efforts to again improve human health. And fast forward now to the COVID-19 pandemic. Indeed, the pandemic actually spurred and accelerated worldwide efforts with groups all around the world embracing this technique, these tools of trying to understand the link between what we see in sewage streams and wastewater streams and how to link that to human health. This is just a summary of our own work. We've been sampling for the last more than 3 years now at different sites, including major sewer sheds in mega cities in North America and some other countries. So we're talking about entire sewer sheds, not just wastewater treatment plants. My group also contributes to the overall community health at my university through sampling about 95 to 97% of our student population. I've been also involved in monitoring efforts in a particular state where we look at incarceration facilities. So obviously we're going to hear more, and there are many more lines of evidence here. And in fact, I'm not uncomfortable saying that wastewater-based surveillance is really the only technique that has actually worked during this COVID-19 pandemic. And there are many reasons for this. Most recently, essentially not much data in terms of testing, not much data available in a timely fashion with respect to case numbers and so on and so forth. So, but for wastewater-based monitoring, we have been blind. There have been efforts in terms of trying to correlate or calculate case numbers from wastewater numbers, and that's somewhat of an open question even now. We need some very controlled data to be able to do that. There have been some success stories on that end. There have also been some not so successful efforts. So that remains a question that, and we'll have to decide whether we really want to do that make that correlation or not, or whether we want to rely on environmental surveillance as the driver to towards enhancing and protecting community health. And that's been working as well. There are many advantages of looking at environmental buckets, especially with respect to SARS-CoV-2 and COVID-19, because for this case specifically, the wastewater signatures are able to, in a predictive fashion, tell us something about community health. It may not work this way for all diseases, but it does seem to work for some for COVID-19 under certain circumstances. What we are also doing is we are of course interested in quantifying SARS-CoV-2 concentrations, loads, and so on and so forth. We are interested. We do a fair bit of genomic-based studies as well, trying to identify the variants. But for us, it's not the who and the how many alone. And it's tempting to just focus on that because we have a target now. We have SARS-CoV-2, but I'm not really sure that's the only way to go about doing this. What we are also interested in is questions like what makes Omicron Omicron? What do they have inside? What makes a Delta? What do they have inside? And we're not done with that. How does that link to human health? So we are essentially going after different potentials inside the genome in this case to figure out what can an alpha do and so on and so forth with respect to infectivity, replication, and so on and so forth. So it's not just the who and the how many, it's what is it that they can do. And again, this is all within the limited context of SARS-CoV-2, but of course we have to look beyond. We have, again, like I said, a target now. What we don't know are the unknowns. So it's the classic unknown. What don't we know? What else can they do? Who else is there? And so we have been involved in this study, focused on a fairly big section of India, where we are looking not just at individual viruses. We are looking at the community of what is in there in sewage, septage, fecal sludge, and so on. So this is more functional. It's not just the who and the how many. It's functionality. And so there we've been able to look at other functionalities, including resistance to antimicrobials and so on and so forth, but also the who harbors what. Is there any horizontal transfer of functionalities amongst organisms, pathogens, non-pathogens, and so on? How are they talking? How are they exchanging information? Ultimately, what is the potential and extent impact on human health also? So I think that's all I have. I think there are some excellent presentations to follow and a panel as well. Thank you.
Thank you so much, Kartik, for setting the scene for today's event. I will then move into European perspectives on wastewater surveillance, some case studies for Turkey and Sweden. So I'll pass the floor now to Bilgi and Zeynep to embark on this journey. Thank you.
Okay, thank you, Heidi. Okay, good morning to all of you. I'm really pleased to be here to make the discussion about the 3.5-year experience of Turkish Water Institute. Before summarizing what we did in Europe and what we did in Turkey, I would like to first very briefly mention the benefits of the wastewater-based epidemiology. As you know, the wastewater is coming from the communities, and it means it is the signature of the community. What I mean by signature of the community, by measuring wastewater, you can monitor the viral diseases, pathogenic diseases, but these are not the only. You can also monitor the chemical markers like illicit drugs, personal care products, industrial chemicals, and also you can monitor the antimicrobial resistance genes and bacteria. Certainly, it is very economic because you are taking a sample from a wastewater treatment plant, which is serving sometimes hundreds, thousands, or sometimes millions of people. With low number of samples, you have an ability to monitor the high number of people with low number of samples. And during COVID-19 pandemic, we realized that it is really a good method to identify and detect the variants of SARS-CoV-2. And also, we proved that it is an early warning tool. What I mean by early warning tool, since when people receive the SARS-CoV-2 virus, they are not directly showing the symptom, but you have a chance to monitor the virus in their shedding. Therefore, we have a chance to monitor the virus 2 or 7 days before you are observing increase in the cases. And because of those reasons, the countries started to apply the wastewater surveillance activities to monitor the SARS-CoV-2, and as of now, there are 72 countries in all over the world applying wastewater surveillance activities for the monitoring of SARS-CoV-2. Okay, this slide is a little bit crowded because there are 3.5 years here. There are major milestones in Europe. Everything started with the first preprint by Gerçan Medema in March 2020. And a few countries followed this preprint, and we have started to monitor SARS-CoV-2 in wastewater. Turkey is one of these countries. And then the European Commission Joint Research Center started to arrange town hall meetings. We are really thankful to ECJRC for these town hall meetings because we met there. Most of the panelists here met in these town hall meetings. We collaborate there. We share our knowledge. We share our findings. So it is continuing, and the 10th one will be in Frankfurt in November. 2021 is a major milestone because HERA was set up in Europe and the DEEP platform was set up. DEEP platform is now still going and publishing the national results of European Union countries plus the neighborhood countries. You can follow up this web page. And 2022, I think the most beneficial year because we are familiar with the wastewater-based surveillance activities at that year. And the most importantly, who published the interim guidance document, Kate Medlicott is here, and I think she will talk about this. And most importantly, the statements appeared in the G7 leaders' declaration, and also European Union Wastewater Directive included statements about the inclusion of wastewater surveillance for the public health monitoring. It is the draft document, but it is under discussion. And in this year, we extended the borders of the wastewater surveillance from regional and national borders to the global scale. And some countries started to apply the wastewater surveillance for the aircraft monitoring. And Zeynep from KTH will talk about this during her talk. And a very big project, joint research, joint action project, just accepted. It covers about 26 countries, and there will be the incoming events in November and in May. So there are many things that we can talk, but those are the major milestones in the Europe. And if I come to Turkey, we are doing the surveillance since the beginning of the pandemic. We are scanning the whole Turkey. 21 pilot cities scanning 42% of the Turkey, which corresponds to 33 million people because Turkey has a population of 85 million. And Istanbul, as being megacity, having 15 million population, is under scanning every week. Still, it is ongoing. And we are publishing our findings on colored maps for the easy understanding of everybody who are not familiar with molecular analysis, qPCR, NGS concepts. So we are really successful for this publication in order to take the attention of the public for the results. And one of the distinct characteristics of the project is it is 100% governmental project. It provided the sustainability of the project. All the stakeholders of the projects are either governmental organization or state university. And I think you know that there was a big earthquake in Turkey in February, and we just started to apply somehow. We are trying to apply the wastewater surveillance experience for 3.5 years together with the other organizations to the earthquake zone for the monitoring of the possible epidemics. And during this period, we faced many challenges. First of all, if you would like to apply nationwide wastewater surveillance activity, you have to take the political support. Otherwise, you cannot continue. Fortunately, we have this. And you have to, if you would like to do this under One Health approach, then you have to provide the interconnection between the ministries. which is a very difficult task. You need manpower, but I'm not talking about the manpower of only one discipline. You need manpower of different disciplines, which is a very difficult part of the project. And certainly you need somebody, one organization which will coordinate all these different disciplines. Sampling can be a problem, cannot be a problem. It depends on how big your country is. Turkey is a big country, so sampling long distances, transfer of the samples to the labs is a big problem under cold chain. If you are using the wastewater surveillance for the viral detection, then you need BSL-2 labs, which is, again, can be a problem. If you are in a middle-income country, you need consumables. It can be a challenge. And certainly you need standardization of the methods, and most importantly, as Kartik talked about the NGS analysis, you need bioinformatic experts on wastewater, not the human genome only. But among all these, the most important thing is the data use. I think all countries are facing about the use of data, who will use the data and how they will use the data. This is still a big problem. And certainly the sustainability of the project requires funding. As Turkey, we have some future strategies. Very briefly, we will digitalize our surveillance activities because we are a very, very big country, 85 million population. It is not easy to arrange all this organization for such a big country manually. We are somehow trying to integrate the Ministry of Health to our activities. We are following European Union activities very closely, and certainly the wastewater directive, draft wastewater directive, is very important for us, and we are planning to extend the analysis percentage from 42% to 70%, which will be required by the wastewater directive. And certainly we will not only use the wastewater surveillance for viral disease detection, we will extend the borders to the contaminants of emerging concern. I mean, it will be also the environmental monitoring and AMR and AMG. Thank you for your attention. Okay, thank you, Heidi.
Thank you so much, Bilge. Thank you for these reflections on the lessons learned from the work that you're doing in Turkey. I'll pass over to Zeynep and invite you to continue the reflection on this work. Thank you.
Thank you so much. Today I will give the brief information about how was this wastewater surveillance in Sweden. Actually, firstly, I want to start what was the difference in Sweden during the pandemics, apart from the other countries. The population of the Sweden is relatively low, around 10 million, and we are a big country, so the population, it is a bit diluted. It is a big advantage, actually, for such a pandemics. And when almost all the world were locked down, we were not. The schools were open. We follow the recommendations. Most of the people work from the home if they can do. Only the high schools and universities in the very first pandemics, they follow the online lecturing. And we also started to apply the routine test from the June 2020 till the February 2022. And with this different application, actually Sweden are not in a bad situation when we compare at the end of the 3.5 year, comparing to the ratio in that per the million populations. Sweden is ranking in the 46 in the whole world. The different from the Turkey, we did this wastewater surveillance in Sweden by the universities. As a KTH, we started to monitor the wastewater in Stockholm by April 2020, and we expand to the Malmö by the August 2021. And there are the other universities also were monitoring the other cities. We were monitoring Stockholm and Malmö. There are the two big cities of the Sweden, so we could cover more than the 2 million people. We work with the 4 different wastewater treatment plants and total 7 different inlets. When we checked our overall results, as you can see here, the waves are the different, the numbers that we could detect. There are the many reasons to explain this. It was about the methodology, it was about the storage conditions, and we learned many things also during these pandemics. But even in the very beginning, you could not see here, but we detected the virus in the wastewater samples, and it was correlated with the case numbers very well. So the correlation on the left side showed the, or right side, showed the whole entire 3.5 year or 3 years, let's say, during the pandemics. And also, we learned many things on the way. To use just the engine copy numbers for the SARS-CoV-2, or to make some adjustments and normalization in the wastewater data, we ended up the normalization gives much more real cases. These are similar numbers for the Malmö. The time period is a bit shorter. And also I forgot to mention, as Kartik told, that we can use also correlation to make the estimation. Sometimes it works, sometimes it doesn't, but for the Sweden it worked very well. So Sweden followed this massive test. Maybe I can show in that graph much better. The yellow ones, it is the case numbers, but they stopped to apply this massive testing in February 2022. So we decided to use our data to estimate the case numbers, and the green dots on the screen showed our estimated case numbers for the cities. It is the same for Malmö as well. Apart from the quantification, we also wanted to see the variant analysis, so we sent the samples to sequencing. We have the wider data, but I wanted to show here at the end of the 2021 and the beginning of the 2022, we could see that how the Delta variant is losing in the population and the Omicron getting much more dominant. As I told, we learned many things on the way. Then this year, we changed our bioinformatics analysis. We used another method, Freya, and we could detect much more lineage of the Omicrons. And also, even these graphs, we can see that how the BQ1 is getting disappeared and the XBB 1.5 getting dominant in the population. Also, we published a paper to share our overall conclusion about the monitoring, so you could read more. As Bilge mentioned, the beginning of this year, EU Commission requested from the member states if they can follow the variants and the numbers of the SARS-CoV-2 viruses in the aircraft and the airport sampling. And in the Stockholm Arlanda airport, we started to do this in January 2023, and we continued till the end of May 2023. You could see my very sophisticated sampling bottle there, because in the beginning it was an issue how to go to the sampling, and I was questioning about my profession about this when I was there. It was a challenge. But if I reflect my overall conclusion, this sampling is important for the variant monitoring, if there are any newcomers, but it is not easy to conclude based on the numbers. And also, the sampling strategy is really important. And as far as I know, that in the EU Commissions, they developed some equipment for the sampling, so now the life is a bit easier. Of course, there are the beyond of the SARS-CoV-2. So by the time also from the EU Commissions, we received some requests to develop the methods to monitor the other variants. One of them was the monkeypox. We developed a method for this, but we couldn't detect any in the wastewater because the case numbers was very low in the Sweden. The other outbreak was the new hepatitis. It was detected in the children's last year in the springtime, where there were many case numbers in the UK and the US. We developed also a method at KTH to detect these new adenovirus, F41 virus in the wastewater, and it worked very well. Also, we have a surveillance data, and we are sharing the results soon in a publication. Also, we are monitoring influenza A and B, and also antimicrobial resistance genes are important. They were important also, not is getting important today, but by the day the EU Commission proposed a new wastewater directive, so it will be much more important parameter for the wastewater. And we did a similar study in India, the groundwater and the surface waters, and it is dramatically high, really, in all the water bodies. And as a KTH, or this also I can conclude as within the current and the future plans, of course, to expand the monitoring, but also not only focus the pathogens, to focus the pharmaceuticals. We have archives during the last 3 years, so we want to check by the exposomic unit of the Science Life Lab if we can use the chemical analysis as an early warning system for such a pandemics. For example, we start to see the increase in the wastewater for the SARS-CoV-2 in week 5, but maybe the people start to use much more paracetamol in week 3. So it is also important. So we want to also expand our research to that point. And of course, the antimicrobial resistance genes are important, and we are working on this. And as all the countries, we need to train the people for the future outbreaks and the pandemics, because by the April 2020, the big challenge is to find the people who can work on this area. And also, we need to discuss more how we can use this data as an early warning system. Thank you so much.
Thank you so much. I will now go and invite my colleague Alex, who will lead the further panel discussion and as a moderator. Alex, over to you.
Thank you very much, Heidi. I'd like to invite the other 2 members of the panel, discussion panel that are present here. We have Francine Harsad, Senior Lecturer in Public Health Microbiology in Cranfield Water Science Institute, and Kate Middleton, Sanitation and Waste Team Leader in the World Health Organization. Please. We're going to have a 30 minutes panel discussion here. We had selected several questions from the community work on the topic. And that will be followed by some questions from the audience, both in person here and also online. And then in the end, we're going to have final statements from the panelists, and Heidi is going to be invited again to come here for closing reflections and next steps. So thank you very much for being here. Thank you very much, everyone that is there online with us and the participants here in the auditorium to climb up here and then climb down. It's not easy, so we really appreciate your participation here. We have our first question to Zeynep. I have a colleague that he loves to say that wastewater always have been negligent. But it seems that now the paradigm is finally shifting. Do you agree with that statement? Is this really the case?
Thank you. Yes, I think so. As a wastewater engineer, I think we were waiting for this for a long time. Yes, by these pandemics, it was, of course, a dramatic situation. The importance of the wastewater is getting much more. But the point, actually, now we know that we can monitor the pathogens. We can monitor the antimicrobial resistance genes, but also there are the other important things in the wastewater. Wastewater is a very nice source to recover the many things, not to just focus some things that we need to treat. It is not only, that unwanted item. We can use the wastewater like a mine. We can recover carbon, energy, phosphorus, some nutrients. We can produce biofuel from the wastewater. So wastewater is not limited just by the pathogens or some pollutants. So the wastewater could be used for the many purposes. And of course, apart from these issues, we can focus much more for the epidemiology.
Thank you. Thank you. Thank you very much. I would like also to invite the panelist number 6. She's online, and I just got the confirmation that she's there with us. It's Angela Terrasolo, Policy Officer for DG ERA on the European Commission. Thank you very much, Angela, to be here online with us. And the next question goes to you, Angela. Why are so many countries still lagging behind when it comes to wastewater surveillance? And what can we do collectively to address this situation? Please, Angela, the floor is yours. Try to keep the answer to 3 minutes so we can have that amazing discussion. Thank you.
I will do my best, Alex. Thanks a lot for the introduction and for the invitation. I hope you can hear me well.
Yes,
and I'm
we
very
do.
sorry I cannot be there with you today, but thanks for allowing me to join remotely. Well, the question is not an easy one, and of course, there are several reasons that contribute to why many countries are still lagging behind in implementing effective wastewater surveillance. We saw that with the recent pandemic, policymakers and decision makers, which is sort of the perspective I will try to bring in today's discussion, they realized that wastewater surveillance has a huge potential in providing early warnings against health threats. We heard that from Bilge and Zeynep before, and therefore the role of wastewater surveillance has rapidly strengthened. And also as a result, wastewater surveillance is now more and more recognized by policymakers as a powerful tool for improving pandemic preparedness, but also to inform public health decision making, and especially to address challenges that are linked to the scale up of wastewater surveillance for public health. And it's important to say that even within Europe, there are major differences between countries and major disparities. And we can easily say that the current European wastewater-based infrastructure is still under development. So at HERA, the European Health Emergency Preparedness and Response Authority of the European Commission, that was created a couple of years ago, we have conducted a survey to identify some of these challenges, and the results highlighted indeed several aspects that we need to improve, and some of them were already mentioned by previous speakers. For example, there is a limited coordination and data sharing. We lack standardized methodologies and comparable data. Wastewater surveillance is not yet integrated with existing public health surveillance tools. There is generally a lack of funding. Many countries lack also the necessary infrastructure, equipment, laboratory facilities, for instance, but also technical expertise for efficient wastewater collection. And in some regions, despite all the positive developments, policymakers and the public do not yet fully understand the importance of wastewater surveillance for identifying disease outbreaks. And more generally, we observe that these challenges, they're even more pronounced when it comes to low and middle income countries. And it's fundamental, in our opinion, not to leave them behind. So collaboration is key to address these main challenges. And there are definitely a number of steps that we can take collectively. For instance, countries that have a better expertise can assist those lacking resources to develop and implement surveillance programs, but also international organizations can provide funding for infrastructure development and capacity building. We can run some awareness campaigns and training programs. And of course, we need to encourage countries to share data and best practices in order to accelerate and progress towards innovation in wastewater surveillance techniques. And let me just conclude by saying that to contribute to all these objectives, in the past months at HERA, with several partners that are represented today as well, WHO, UNEP, but also the Bill and Melinda Gates Foundation, and many others, we have kicked off a process to establish a global consortium for wastewater surveillance for public health. This global consortium will not be a funding instrument per se, but rather a collaborative network that will help address many of the shortcomings that we have mentioned earlier. We are still in a very preliminary phase of this global consortium, but the contribution from stakeholders active in the field is crucial. So I would like to take the opportunity, Bilge just mentioned it, to extend to all of you the invitation to the international conference that is organized by HERA and the Joint Research Center of the European Commission, and that will take place in Frankfurt, Germany on the 16th and 17th of November, precisely to advance the discussions on the establishment of a global wastewater surveillance consortium for public health. So please mark your calendars, and I hope to see many of you there.
Thank you. Thank you very much, Angela. And we really hope that the consortiums will leave no one behind, especially countries in Asia, Africa, and Latin America and the Caribbean. Thank you very much. The next question is going to be addressed to Kartik. Kartik, environmental and surveillance, where do we start from, and how is surveillance help us through tackling our many environmental challenges? We are talking about health, but how surveillance can also help us to track environmental challenge, especially the need to protect our aquatic ecosystems. Please.
Yeah, thank you. So we've understanding the boundaries around this session. We've focused on the built environment, engineered wastewater treatment systems, sewage, and so on and so forth. I'd like to start with, let's say, trying to open up those boundaries. In much of the world, there aren't centralized treatment facilities, which is where most of the focus has been. There's been extensive work done in South Africa around non-sewage systems as the basis, as the sampling focus for SARS-CoV-2, and I think that's something that we can learn from and expand as well, given that the bulk of the world's population does not have access to centralized treatment systems. So that is something I think that we should be focused on, and not just on the environmental side, but again coming back to this model of protecting and enhancing human health. So I think that's something that we need to do. On the environmental side, what is happening in terms of a confluence between human health and environmental quality, water quality, and air quality even. More and more compounds, chemicals are being regulated, targeted for regulation. A lot of these compounds are somehow we are contributing to the environment. These are not natural chemicals. These are xenobiotics and anthropogenically produced chemicals. Yes, certainly there are studies needed where we look at the transformation, the degradation of these compounds in engineered systems, but still we lack information in terms of the flux of these compounds through the environment, through different environmental reservoirs, air, water, soil, and so on and so forth. We can apply the same principles that we have discussed today towards first understanding what the fluxes are, where are the hotspots, and then start to develop and impose or adopt strategies for their management. So I think those are two directions. But coming back on the microbial side as well, I think it is really, really crucial, and expanding that to the chemical side as well. Right now, we've had the luxury of running after one target, SARS-CoV-2. I don't think this is not the time for us to kind of stop or fall in love with our techniques and this approach. This is the time to frame even better questions.
Thank you. So we have to frame even better questions. And can you tell us, Bilgen, what does wastewater surveillance tell us that we do not know yet from other forms of surveillance? What are those questions that we should follow?
Okay, thank you, Alex. Maybe for our audience, we have to first classify the surveillance methods. I mean, if we are talking about the COVID-19 specifically, for the other diseases as well, there are two major surveillance methods. First one is the clinical surveillance, the other one is the environmental surveillance. Maybe up to COVID-19, we were familiar with the clinical surveillance. And what is the meaning of clinical surveillance? we all know that it is done majorly for the diagnosis purposes. So it is done for the people who are showing symptoms of the disease. Certainly, it is also used for the screening purposes, but very limited scale. Why? Because first of all, it is not economic to scan the people who are not showing symptom. Where it is used for the closed places like prisons. The clinical surveillance, Kate knows better than me, but there is a limit for this. 1 person for 1,000 people per week. There is a limitation for this economically, because it is not economic to scan all the people in the closed buildings like prisons, like, you know, the healthcare facilities. And also it is done for the people who are continuously in contact with the virus, like healthcare workers. It is done for the refugee camps. Okay, but it is limited. We never use the clinical surveillance regularly for the people who are not showing symptom. It is impossible. First of all, people should understand that. I think it is not understood very clearly up to now. Environmental surveillance or the wastewater surveillance will not replace the clinical surveillance. It is impossible. It is not a diagnosis method. It is completely different, okay? The aim of the wastewater surveillance is not to diagnose a disease. It is just scanning a population in an economical way by taking a low number of the samples. And we are just we are just observing the intensity of the disease in a region. This can be a small region. This can be in national scale. It can be global scale, as Angela said. This is our last target. Also by monitoring the wastewater regularly, in a cheaper way, we can observe the increase in the trend of the disease or the decrease in the trend of the disease. This is why we are still continuing the wastewater surveillance in most of the countries. Although the pandemic is over by World Health Organization declaration, we are still continuing because we would like to be ready for the new attacks. We would like to be ready for the new variants. And you know that we are talking about Alice variants now. How we know this? Because we are monitoring the wastewater, and we are in communication among the European countries, in which country it is increasing, in which country it is decreasing. This is the benefit of the wastewater surveillance. You cannot obtain this data from the clinical surveillance. Those are the major benefits of the wastewater surveillance. And also we had the chance to monitor the more than one parameter. I mean, by taking only one sample from the wastewater treatment plant, maybe I can give an example from the Istanbul. Istanbul is a mega city. We have huge wastewater treatment plants having capacity of, one treatment plant is serving 1.5 million people. By taking only one sample from the inlet of one treatment plant, I'm just scanning the 1.5 million people. You can estimate how economic it is. And also there is now we are discussing in the meetings, in the webinars, the multi-assay scanning. By taking only one sample, we can scan not only SARS-CoV-2, we can also scan influenza as well. Why not? So this is also the other benefit of the wastewater surveillance. These are all in my mind. And also certainly for the emergency zones, we can adapt the wastewater surveillance in an economic way.
In an economic way, yeah.
Mm-hmm. Thank you.
And the economic way, it's quite related with the methods that are out there that can be used. And Kate, let me ask you, what's the current status of the methods for wastewater surveillance? How these different countries are using those methods, and are those methods available even for developing countries, least developed countries, small island development states? How those optimal methods can help decision makers from different countries' settings? Please, Kate.
Certainly. Okay, so is that working? When we're talking about methods, I think we have to start talking about specific targets and pathogens. So, for example, we can start with polio. Polio has been really well established as a method. It has a global method, unlike pretty much all of the other targets, and it's really clear what what the methods are and what the use case is for the use of that data, and that's been rolled out, globally in all countries at all levels, especially areas where polio is still not eradicated. So these are places with low sewage coverage and so forth. But I just want to kind of be really clear, because I think there's a lot of excitement now and a lot of keenness to roll out environmental surveillance like everywhere for a whole lot of targets. But looking at the case of polio, that's a major global investment in capacity and lab strengthening and you name it. So you want to be really clear that the methods are good, they work, and they tell you something cost effectively that you don't know from other forms of surveillance. I don't think we're fully there yet with all of these other targets, but there's some really interesting work coming online, whether that's for cholera, for mpox, for flu, for SARS, of course, that kind of kicked this big wave of interest off, typhoid, TB, hepatitis, measles, illicit drugs, AMR, you name it. What we want to do with the methods now is be kind of really systematic and careful at looking for each of these targets. What do we know about how much of it's actually shed in excreta? What do we know about how long it persists in the environment? What do we know about how to do effective sampling and the laboratory methods for that? And how do we link that data effectively with public health decision making so it's used in a timely way? For all of these targets, they're all at different rates of development for those methods, and I think we need to be pick up on this excitement, run with it, but also I don't want to be in a position where we're providing advice to low and middle income countries to invest in technologies or methods that are not proven yet. So I think that's the kind of the balance we're trying to strike here.
Thank you. And to find balance on surveillance touches another very relevant topic, ethics, because we are surveilling, we are getting information from people, not necessarily with their consent, but using wastewater for that. So, Francis, can you tell us about the ethical aspects of surveillance, please?
Thanks very much. Yeah, so I think ethics is a really interesting issue that perhaps has received perhaps less attention than the successes that we've had in surveilling for different targets, for example. So from experience of the UK programme, so this was the English wastewater surveillance programme, we rapidly hit an ethical barrier when we started to surveil small populations, so communities that are very remote. Lots of our population, particularly in Scotland and Wales, are off-grid, so they actually have non-sewage systems, which is very similar to perhaps what you might see in lower-income countries. So we did a sort of review of this and came to a sort of threshold value of 100 persons as a number. Anything above this we were comfortable, anything below this we weren't comfortable. Honestly, it was hand-waving because there was no data to support what level you can actually determine and detect the individual from the aggregate sample. So the non-invasive nature of wastewater surveillance is its primary benefit. The cost is obviously an important one that Bill Gay and others have already talked about. So if we're thinking about the key aspects of privacy and anonymity of the individual, people consent to having a nasal swab sample, but you don't consent to having your wastewater sampled. At least most people don't. So when we've done tests for other purposes, for example, looking at designing toilets, for example, we have to take extra precautions when we're receiving fecal samples from individuals. So it might sound strange, but feces is a human tissue sample, and so therefore it comes under additional regulation, and you have to take extra precautions to ensure that the individual's privacy is protected. Primarily, that is through informed consent. But again, as I've said, you don't give explicit consent with wastewater for that sampling, at least in most cases. So why is this important? Well, if we're thinking about certain communities, particularly in low-income countries or in countries where perhaps some of the regulations around data aren't so well established, you could end up with stigmatization of certain populations. So, for example, if you're surveilling communities which are from a particularly poor neighbourhood or from an area where there might be illicit drug use or production, there is the potential for unfair treatment should you get data on those communities that could give you, I guess, an unfair advantage for police and other issues. So when you're thinking about how to go about this, you would want to ensure that when you are collecting this data, it's communicated to those communities in an effective way. So we've talked about the kind of dashboards that have been rolled out, and I think that's part of the approach to ensure that individuals aren't being, I guess, feeling like they're being targeted by that surveillance, because obviously surveillance is a sort of targeted approach, if you like. So I guess when you're thinking about the ethics of this, ensuring that you're equitable in your monitoring is very important. So you're not just targeting those areas where you think there's a problem, you are also targeting the rest of the population. And we've seen some really great examples of sort of countrywide surveillance approaches, which is one great way of doing this. We've looked at data ownership as well, and do the individuals who are being surveilled own the data? Who owns it? So this is a big issue, and I think that's something that perhaps needs additional thought. International collaboration is key, and we've seen some really super examples of approaches which are being put forward at European level and even global level now on how we can do this. And I think there is a need for ethics to be front and centre in some of those discussions. We've talked about off-grid as well and off-grid sanitation services. I just want to raise open defecation as well. So that's another massive issue. 500 million people still openly defecate daily, and I think there was discussions to actually look at surveilling those open defecation events, so actually going after people who've done it and taking a sample. Now, ethically that is completely unacceptable, and I think there are no clear guidelines, on what is and isn't acceptable when you're doing wastewater-based surveillance. So, in summary, we need to ensure that the individual is protected, the group is protected, and that there are clear frameworks put in place, presumably at a level that is sort of transboundary.
Thank you very much, Francis. It's a complex question, the ethics, but again, it's the trade-off between the advantage of sampling a whole community and then have to ask permit or authorization for using that sampling. But let's now move to the environment, and I have a question for Zeynep. Have we managed to demonstrate the added value of wastewater surveillance as a tool for protecting our environment, especially marine and freshwater biodiversity and the ecosystems and its habitats?
Thank you. Yes, definitely. I mean, now we are talking about the pathogen SARS-CoV-2 mostly. At least for the SARS-CoV-2, we could say that it is not a waterborne pathogen. So it is not a dangerous things for the water, but of course we have the waterborne pathogens, and the wastewater always after the treated discharged to another water body, and there's a water cycle. Sometimes it can be also the freshwater source, or it can connect somehow the freshwater source. So we have to protect our water sources. Nowadays, by the climate change, there is a water scarcity. It means that the contaminants concentration getting higher and higher in the ecosystem. So the pathogens, apart from the pathogens, we have the other contaminants we should take care. One of them is the antimicrobial resistance genes. They are a kind of the micropollutants we could call, and they can be transferred between the microorganisms, bacteria, and it would affect our health system somehow to treat the people. So we should take care of them. But there is no direct way to treat the antimicrobial resistance genes. We just know that we need to remove the antibiotics from our ecosystems. Of course, we need to decrease the consumption as a person, responsible health systems or the individuals, but also we should start to monitor wastewaters in terms of the pharmaceuticals, especially for the antibiotics. But it is not limited by the antibiotics, the hormones. It is another challenge. Personal care products. I mean that it is not directly from the wastewater, but we know that you can find the sun creams on the fish tissues. We are also eating these fish, or we are getting the microplastics from the seafood. So it is just a cycle. So we cannot just close our eyes and that to continue to consume these products. and not responsible for the treatment as engineers, the technicians, or the governments. So the regulations should go from the much more the conventional parameters. Of course, still we should follow them, like the organic contents, total nitrogen, the phosphorus, but also we should consider the micropollutants, personal care products, emerging contaminants like the PFAS. Still, it was a discussion how to remove them or how to treat them. The treatment bringing another cost, the treatment bringing another consumption of the chemicals. So there are the many points, and the wastewater, I think we should go to the details in terms of the regulations also. Consider that these micropollutants and the emerging contaminants in the treatment to protect our freshwater body, to protect the ecosystem, to protect the our recreational water environments, for the many things. Yeah.
Yeah. Thank you for that explanation. Yes, we have to do it, and possibly we have to do it at scale, no, scaling up. We have to do also, just to inform you, we did a trade-off here. We had more time for the presentations, so then we have less time for the questions, and time is running on us. So we have the last question for the panel before we start to get questions from the participants. And I'm going to choose the last question related with scaling up, because that's what we are aiming for. It's amazing what has been done, but if you really want to predict and be able to have an early warning system to prevent the next pandemic or the next big impact in a key ecosystem, we have to scale up that, and cost is a major factor, but not only. So Kate, what is the key for scaling up wastewater surveillance, and what kind of capacity and network would be needed for that?
Yeah, well, I'll return a little bit to my previous response, which was, about being sure that we know the utility of what we're scaling up for, being super clear about the objectives that we're trying to achieve with the surveillance, and then building the capacity towards that, and not kind of broadly, which I think maybe I've sort of misunderstood the question, but with the previous response and talking about environmental protection, that's a completely different kind of objective about, and even, I would actually even argue, sorry to just jump into the last question, but some of these things we can look for environmental protection purposes in water bodies, which is quite different from wastewater surveillance for public health objectives. But if you look for these things, you'll find them. You're going to find them. The detection methods are really good. The question is, what do you do about it? Where did it come from? And lots of those sorts of things we can actually deal with preventive risk management approaches. We don't have to necessarily scale up in testing for everything, everywhere, all the time. But just sort of going back to specifically scaling for wastewater surveillance for pandemic preparedness, I think we can learn a lot from what happened in the SARS-CoV-2 one. And I think what was so powerful and exciting about that was the research networks that popped up sort of quite spontaneously, and we're just getting really high quality information moving all around the world, in high, middle and low income countries, getting pilots going. I think we have to kind of replicate that model, but do it at scale, and then use those kind of research networks to to build out standard methods, to build out laboratory capacity, to share methods within and between countries, and then sort of work towards data sharing networks. I don't think we need all data globally shared everywhere, because quite a lot of data is only really useful at the local level, but where data is has kind of global relevance, to make sure that we've got rapid data sharing networks between the wastewater surveillance people and their local public health organisations, but also the sort of the global community.
The global community. Thank you. Thank you very much, Kate. We are right on the time for the next step of our agenda this morning. That's our questions from the audience. Please raise your hand. I think that I'm going to be doing some cardio, going up there to give you the mic. And I can get like 2 or 3 questions from the audience, and then give the floor to the panelists. Please present yourself, your organization, and your question.
Thank you. My name is Mintje Burma. I'm working for GIZ in Jordan currently. And I want to pick up on the question that a few panelists actually mentioned, but didn't answer, which is what do we do with the data actually? So if you have any good example from local public health institutes or practitioners that actually used the data during the pandemic, or even the recent cholera outbreaks, or like, is there really an acknowledgement of the public health sector of the importance of the wastewater-based data? Or is it still the water and wastewater sector looking into it, who doesn't have the mandate in most countries? Thank you.
Thank you for this first question. Another question from the participants here. Please, the mic, it's there.
Hi, thank you for the discussion. It's very insightful. My name is Areta. I'm still a student, master's student from KU Leuven. I'm just wondering, what is the role from the public or governmental sector to enable the wastewater surveillance? Like you've mentioned before that most of the countries has still not yet have the wastewater treatment surveillance yet, and what should the government do, and like the role of them to be able to enable this wastewater surveillance in those countries? Thank you.
And the third question there.
Hi everyone, I'm Rohini from an NGO called CDD India. My question is about the testing methods. Like, you already asked about this question, but I've been really looking for some methods, because being a wastewater engineer, looking at this testing in a lab is always, like other parameters, it is easy. Like, we do all COD, BOD, understanding the wastewater quality. But when it comes to these kind of pathogens, it's always has been a difficult in terms of analysis. Is there a simple methods that we can, follow and get the results? Testing has been always a problem. So like in the first wave of COVID, so we really went behind hospitals to asking for a testing methods. Like, can you help us in doing? But that time they did not agree. But then finally we could find some local lab. But however, I'm saying, is there simple methods to follow? That's my question.
Thank you. So we have the three questions. Can we start for the last, the simple methods that can be used for getting the answers that we're looking for? Then we can move for what the government could do. And then, of course, understand how that is important for public health. Huh?
The last question?
Yeah.
The answer is no. Yes, because there is no method to detect the virus and pathogens. And this is why we mentioned that this is an interdisciplinary work. You cannot perform a sustainable wastewater surveillance analysis with only environmental engineers. Never. You have to work with the microbiologists, you have to work with the molecular biologists, you have to work with the epidemiologists, you have to work with the statisticians. So you need those people. Otherwise, it will not be the sustainable wastewater surveillance. So this is my answer. Okay, maybe my friends have the other answers.
Yes, please, Kate.
I'll have a go at some of them. So on the question about data use, I mean, that's like totally key. So if you look, I think someone showed the COVID Poops website, and it's quite amazing. It shows all the different places that things have been done on COVID wastewater surveillance. But when you sort of dig into those, lots of those are like research projects that were done with the water community. But it'll be up on the website hopefully in a couple of weeks. It's fully approved. We've updated the guidance, and you can see the links to the case studies in there. And all of those case studies, we only pick them because they show that there's not just data for an interesting kind of piece of research, but that's actually been used for public health decision making. So that's whether that's for early warning, whether it's to reinforce risk communications, like you see in some places, people hear it's been found in the wastewater, and then they'll be more likely to respond by seeking vaccines, wearing masks, and so forth. or for tracking down variants. But sort of linking to the second question and what's the role of the government, I think we really have to see that public health leadership in this. Otherwise, you run the risk of exactly what you were describing, that it stays in kind of a research domain and the data's not being used. And I think some of it that's good actually. Some of the research does need to be done but once it's at maturity and useful, we absolutely need to be sure that those links are there.
Can I just add to that, please? I mean, I think excellent points. And, with all of these questions, when you look at it through a low or middle income country perspective, wastewater gives you a lot of information for a very small amount of money. So it is scalable to these communities. I think there is some work going on now looking at container-based sanitation systems and off-grid, so pit latrines and other sort of, I guess, technologies that you'd normally associate with a low income setting. And another point I just wanted to raise is we've made the assumption, a lot of the people that work in this field, and you can see that there's a lot of passionate people here that have really sort of progressed wastewater surveillance in their respective countries, which is fantastic. But we're making the assumption that the next pathogen will be a category 2 pathogen. So for those that don't know, a lot of the wastewater people that did a lot of this analysis relied on having access to laboratory facilities. So most of the laboratory facilities that do this kind of clinical microbiology work are either considered to be biological safety level 1, so you can work with things like E. coli, or biological safety level 2, where you can go up to about norovirus level of infectivity. Anything beyond that, you need additional facilities, what we call a category 3 or 4 level facility. And so if the next pathogen happens to be a category 3 pathogen in wastewater, then actually we need to go back to the drawing board and think again, because a lot of these labs that have been set up are only accredited to biological safety level 2. So I think, when you're talking about the public health responses that people have made with this data, I think quantifying that is essential. And I think, what was just discussed over there around COVID poops and ensuring that there is that end-to-end stakeholder engagement, I think is really, really useful. And those case studies showing the utility of wastewater really need to be, I guess, disseminated more strongly.
Maybe I can add.
Yes, please.
So in terms of data use for protecting human health, I'm personally involved in a couple of projects. They are on what I would call two ends of the spectrum. One end of the spectrum is in this entire state where we cover all the incarceration facilities. So wastewater testing serves as the driver for clinical testing, because clinical testing is expensive. And there are other limitations and pressures inside the prisons. And so wastewater is really the top line information that comes and then drives everything else. And that's been going on it's been going on since August of 2020. So it's been working well. And that's on one side of the spectrum. The other side of the spectrum is, again, what I would call a captive population of a university, where wastewater testing again drives testing or other measures to protect health in these dense communities. So these are very specific examples that I know that I have worked on. I don't know if Kate, if these are also on your radar, but these are ongoing now as well.
So we have clear that's been using for public health. We have clear that there is no simple test. But what about the question on government? Oh, Angela wants to talk. Please,
yeah,
Angela.
Indeed. It's precisely on this question I would like to come in.
Fantastic.
And to complement from our European perspective, of course, I'm not speaking on behalf of member states, but what we have seen in the past months was a significant interest from national countries to extend wastewater surveillance activities, mostly because they realized the cost effectiveness of this method, as it was pointed out several times, and to support member states. Actually, in 2023, the European Commission, HERA, has allocated 15 million euro for a joint action that has the objective of enhancing, extending, but also institutionalizing wastewater surveillance for public health, not only in Europe, but also beyond. There are 61 partners from 26 countries, that's really huge, that are part of the consortium. And the overall idea is really to support national governments and agencies to improve and consolidate their activities on wastewater. And especially this is done by joint underlining the efforts to improve information sharing, to improve capacity building, education and training for advancing wastewater surveillance efforts. So the focus of this joint action is really to support activities to improve national public health wastewater surveillance capacities, and even if it's, of course, entirely up to member states to decide what to invest in, with this joint action, the European Commission is really trying to support the efforts to institutionalize wastewater for public health.
It's good, quite good to hear that amazing support the European Union is giving them. We have also questions from the chat, but time is running, so I just have to thank you, Gilbert, Kibet, Ronald, for the question, as well as Bihanu, Genet. We're going to pass those questions to the panelists for them to answer, but not now, because time came on us. We thank a lot all the questions that we received, but we have to move to our next step. That would be a second Mentimeter that I will invite my colleagues, Ricardo and Avantika, to share that in the screen with us. And for you again, to please enter there, as we are sharing here the code, please enter there, mentimeter.com again. And let's see what are the... Okay, so now you have a different number there. It's 67259590. You can enter, and we have our first question. Has this event helped you to understand the importance of sustainably managing wastewater and its benefits? And we are having 2 answers already, third coming, and of course, it's been there between absolutely and yes, this was an interesting event. Not so much. There are many questions for sure. 1 hour and a half, it's not enough for that. But again, we can do a master class on that, and it would not be enough yet, because it's multidisciplinary, it's complex in many phases. Thank you very much for the answer, but the general is that yes, and absolutely. For the next one, has this event improved your understanding on the topic of wastewater surveillance for both public health, but also for sound environmental management? And we have the first answer on yes. 4 answers now coming, and all of them around yes. And we need more on this. I learned a lot. And well, not really. I knew already everything that was used here. So yes, that's a very specialized audience, and that's important for us to know. Thank you very much. 14 answers. Let's move to the next one. So do you think wastewater surveillance could be a valuable tool in monitoring public health and environmental issues? And we have already some answers there. I mean, yes, I think so. And absolutely, it's crucial that we move forward with well-established surveillance systems. More than 8 answers, now 9 around that. So it's quite good to see these. Let's move to the last one for the sake of time. And how do you see your country or organization engaging more in wastewater-related activities, not only wastewater surveillance? I want to engage more and more on this domain. We have 2 answers there. We need much more action, but where it starts from? I see potential, but I am not sure how to unlock it. So we see that there is potential, but we are not really sure yet how to unlock it. So events like that, the participation in the global consortium, the event that's going to happen in Frankfurt in November would help maybe you to understand how that can be unlocked. Thank you very much for the answers. We have now for the panelists 1 minute for final reflections, and we could think about why would you encourage governments and maybe even business to start and invest in wastewater surveillance for public health and environmental management? And what could be the next steps? So 1 minute for each of you. You might start from here and move there. So Kate, please.
Well, first I would be very careful about what I'm proposing, and not just to invest in environmental surveillance per se, but around a very specific objective, and to be clear about which pathogens you're targeting. And I would separate out the issues of wastewater surveillance for public health, pandemic preparedness response, and the kinds of monitoring of water bodies we do for environmental protection and understanding. And on that side, I would be very much promoting preventive risk management approaches before just sampling in rivers and so forth. I'll stop there.
Zeynep?
Thank you. Maybe it can be also the answer one of the questions. I think the much more the governmental needs and also maybe the business perspectives are needed to continue this issue, because to practice the method. So the method is challenged. It's not accredited methods like the COD, BOD, TS. So, and it is possible to make a kind of at least the uniform method and applicable for all the countries. So I think we should encourage the governments and maybe some of the companies in the field for this purpose.
Thank you.
I can venture to say something controversial. I think given everything that's happening and given the way things have changed and are changing, I would like to see each of us and many more of us, the 7 billion or so of us who live here, have timely access to what our bodies are doing and what they are saying and what they are telling us. Not to wait to go to a laboratory which may not even have the techniques. How powerful would it be if we had our own health in our own hands in a timely fashion? So if surveillance can help, not just environmental or wastewater surveillance for sure, if we had techniques that could allow us to diagnose ourselves, maybe not take actions because not everyone is equipped, that to me would be that to me is the holy grail right now.
Thank you. Let's give the floor to Angela, and then we go back here.
Yeah, I would like to echo what was already said and try to summarize it also from our perspective. I think the main goal is really to equip countries all across the world with a cost-effective tool for prevention, early warning, and pandemic preparedness. That's what we would like to have untapped for wastewater surveillance.
Thank you. Please.
Okay. Most of the things told by our colleagues, but certainly to be ready for the new pandemics in the most economical way, and also to be ready for the silent pandemic this is called by the WHO as silent pandemic. This is the wording of the WHO for the antimicrobial resistance, genes and bacteria detection. And most importantly, what Angela says, it is quite important, to be ready for all those things as whole world, not only high-income countries, but also low and middle-income countries. We have to force the government continuously because we see the answers of the audience. It is not easy task. We have to resist. We have to continue to explain the benefits of the wastewater-based epidemiology. This is why we are here. So we will continue our activities to explain the people, especially to the decision makers and policymakers. And there will be one more very important activity, Alex, in Bali, Indonesia, in May. And it's really a political environment because it's the World Water Forum. And we will continue as a group. There are many colleagues we are collaborating. We will be there to disseminate this benefits. So we will continue our activities, okay? Okay, thank you.
Important. Thank you, Francis.
Yeah, it's my pleasure to finish off. So, I think echoing again what was said before, the comment that was made around individual health is fascinating. One aspect that has been looked at in the UK is around the suitability of wastewater as a public health method for detecting what we call incidence, which is new infections, and prevalence, which is overall level of burden of infection. And so wastewater is excellent at prevalence. It's really not very good at incidence, simply because if you've got high levels of infection, which might occur during an epidemic or pandemic, the baseline level of loading of these targets that we're looking for is fairly high. So it means that your sensitivity to detect new infections is not so good. But if you're thinking about bang for buck, so cost, you cannot get a better method for measuring prevalence. Prevalence is important. Incidence is very, very important if you're looking to prevent the next pandemic. So I think one aspect that would be really exciting is to try to find new methods that you could integrate with wastewater-based surveillance to get incidence of new diseases or new drug use, etc. So that would be something that I would love to see a bit of attention on. So that could be through Wi-Fi data, paracetamol use was mentioned, other parametric methods for assessing these things. So, yeah, thank you very much.
So exciting way forward, at least 1 year ahead, May next year, and all the things that have to be moving that direction. Now we are reaching the end, and we're going to invite Heidi to come back here with us for final statements and closer reflections. Please, Heidi again, introduce. It's the acting chief of the Source to Sea Pollution Unit there at the United Nations Environmental Program. Please, Heidi.
Thank you so much. And I'd like to thank all the panelists and speakers today. It's a fascinating topic, and there's a lot to share and also to keep learning and exploring about. We've heard about the cost effectiveness of wastewater surveillance when it's looking at both detection of trends and early warning systems. The key, of course, considering interdisciplinary manpower and interministerial coordination, that there are opportunities well beyond the monitoring of COVID SARS, but also with many others, but that there's a need to fine-tune and develop and not get too attached to one methodology that might be used right now. So be open to relationships with other methodologies. The inclusiveness is an important aspect, and the equitability in how and who you're sampling is increasing, and also I think the aspects related to many of these type of pollutants, especially pathogens and micropollutants, and also environmental connectivities that need to also explore risk-based approaches that may already be existing, and ensuring that the way we are monitoring is also shared and with other low and middle income countries, where perhaps high income countries can do some of the early testing and fine-tune, but of course share lessons learned. And this is where we're hearing about events in November and next year in March as well. So I think that those are additional opportunities to get familiar on the topic. And in generally, I think we would be very committed from UNEP side to try and continue to facilitate and host these type of dialogues, and to both promote the less fragmentation maybe across disciplines also, and to look at what the opportunities are to build momentum around wastewater surveillance. We'd like to thank all the speakers again, the online participants, the in-person participants, colleagues in Nairobi that have been helping too, Alex that has been moderating. And really, yes, feel free to connect with us, learn more about the Global Wastewater Initiative, and continue to learn about the topic that's been discussed today. Thank you so much.